All right. Good morning or good afternoon. My name is David Strickland, and this is my descriptive epidemiology assignment presentation. The epidemic I chose for this project is the HIV and AIDS epidemic. To start, I just wanted to give an overview of what HIV is because I wasn't very familiar with it before making this presentation. Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. HIV is spread from the body fluids of an infected person, including blood, breast milk, semen, or vaginal fluids. If HIV is not treated, it can lead to acquired immunodeficiency syndrome, also known as AIDS, and there is currently no effective cure, meaning once you get HIV, you have it for life. HIV progresses through three stages, the first of which is acute HIV infection. Individuals in this stage have large amounts of the virus in their bloodstream and are very contagious. Many people in this stage exhibit flu-like symptoms. This then progresses into chronic HIV infection, also called clinical latency. It's common for individuals in this stage not to experience any symptoms. However, the HIV is still active, is still transmittable, and continues to reproduce in the body. Without treatment, this stage can last for over a decade. Finally, AIDS is the most severe stage of HIV infection. People with AIDS have a high viral load and can very easily transmit HIV to others. They also have badly damaged immune systems. Without treatment, AIDS victims typically survive about 3 years. So, moving on to person, who does HIV impact? 39 million people globally were living with HIV in 2022. 37.5 of these were adults aged 15 plus, and 1.5 million of these were children aged 0 to 14. 1.3 million people globally became newly infected with HIV in 2022, and around 630,000 people died from HIV in 2022. Globally, 46% of all new HIV infections were among women and girls. However, in sub-Saharan Africa, which is the largest hotspot for HIV in the world, 77% of new infections among young people were accounted for by adolescent girls and young women. So, where HIV is growing the fastest and where it's the most prevalent, younger women are a serious population of interest there. Global median HIV prevalence among the adult population is just 0.7%, but this median prevalence is higher among certain key populations. While HIV prevalence is not necessarily dependent on marital status, it is dependent on some sexual behaviors and gender identities. This prevalence increases to 2.5% among sex workers, 7.5% among men who have sex with men, 10.3% among transgender individuals, and the prevalence is also 5% among individuals who inject drugs. In the United States, Black and Hispanic communities are disproportionately affected by HIV compared to other racial and ethnic groups. Black individuals aged 13 and up account for 12% of the US population, but account for 40% of Americans with HIV. Similarly, Hispanic individuals aged 13 and up account for 18% of the US population, but account for 29% of Americans with HIV. This shows that effective prevention and treatment may not be reaching individuals who need it most. And furthermore, it shows that this lack of access to care could be correlated to socioeconomic status, as African Americans and Hispanic individuals have lower incomes on average compared to whites and Asians. And this chart here represents the HIV incidence by race and ethnicity in 2021. And it shows that Black/African American and Hispanic/Latino individuals make up a good portion of these people. I also found data about the effect of religiosity on HIV risk. It was a cross-sectional study conducted in Africa, North and South America, Europe, the Western Pacific, Southeast Asia, and the Middle East. The studies found a religious affiliation to be associated with reduced sexual risk and HIV risk. Protective effects were found among Protestants, Catholics, Muslims, and Hindus. For individuals in these groups, sexual risk behaviors such as not wearing a condom, sexual initiation, and having multiple partners were lower than those who were not in these groups. And according to the CDC, occupational HIV transmission is extremely rare. It is, however, worth bringing back up that sex workers are 3.5 times more likely to have HIV than the average person. So moving on to place, I asked, where does HIV impact people? According to the World Health Organization, 25.6 million people who have HIV live in Africa. which makes up roughly 2/3 of all individuals across the world who have HIV. Outside of Africa, 10% of people with HIV live in the Americas, another 10% lives in Southeast Asia, 8% lives in Europe, and 6% lives in the Western Pacific. Among all the countries in the world, those in sub-Saharan Africa have the highest rates of HIV. The countries with the highest HIV rates in the world are Eswatini, Lesotho, South Africa, Botswana, and Mozambique. And this trend can be very obviously visualized when you look at a world map where countries are highlighted based on the percentage of the population with HIV. The very dark red portion in sub-Saharan Africa, the southern part of the continent, demonstrates this. The environments in these countries likely has a lot to do with the high HIV rates. Firstly, I looked at social environment in these countries. There is a negative association between income and HIV prevalence at a national level and a household level. Some regions within countries in Southern Africa experience widespread poverty. Another social factor that influences the epidemic is access to information. Many infections in sub-Saharan Africa occur because people may not be aware of the virus or its transmission modes and preventative measures. This point is clearly demonstrated by a demographic and health survey from Cameroon. Around 70% of individuals aged 15 to 19 who attended school knew that it was possible for a healthy-looking person to have HIV. Among individuals of the same age who had never been to school, this figure drops to less than 20%. Gender discrimination also influences the evolution of the pandemic. Women cannot always negotiate the conditions in which sexual intercourse will take place, like if there is any certainty about the partner's infection with HIV. They also often do not have the legal or financial means to be autonomous and are therefore submitted to men's economic power. Their unfavorable position is the basis of prostitution, which may appear to some as the only possible way to make money. On a strictly biological basis, the risk of contamination from an infected man to an uninfected woman is 3 times greater than the risk of infection from an infected woman to an uninfected man. Next, I look at biological environments in some of these countries. Malnutrition and parasitic diseases are endemically spread in sub-Saharan Africa, and they weaken the body's immune system. For instance, vitamin A is crucial for epithelial integrity, which plays a determinant role in STI protection. Thus, if malnutrition results in vitamin A deficiency, then those individuals would be at greater biological risk to contract HIV. An unhealthy physical environment, such as lack of access to safe drinking water and widespread slums in urban areas, results in poor hygiene that can also enable the rapid spread of infectious diseases like HIV. Finally, and perhaps most obviously, the proportion of people who have the disease is an important biological determiner. If more people in sub-Saharan Africa already have HIV relative to other regions, then they have a higher chance of infecting others in the region than other regions would have. In this way, the spread of HIV is kind of like a vicious cycle. Finally, I looked at the physical environments in these countries. According to the International Institute for Strategic Studies, 5 of the 10 least peaceful countries globally were in sub-Saharan Africa. In 2021 alone, there were 17 internationalized civil wars in sub-Saharan Africa. Civil unrest and civil war impoverishes populations and displaces them, putting them at increased risk of infection by disrupting social structures. Wars induce injuries that invite microbial infection. Wars force migration of non-immunized individuals into areas inhabited by disease carriers, and they crowd refugee camps with inadequate sanitation facilities. As a result, there's a higher risk of infection. Now, finally, moving on to time. When did and still does HIV most impact people? The first reported cases of HIV were in 1981. The 1990s saw a substantial increase in people infected with HIV and dying of AIDS. In the second half of that decade, over 3 million people were infected with HIV yearly. Since then, the number of new infections began to decline, and it's now below 2 million, the lowest number of new infections since 1990. As for mortality, AIDS-related deaths increased throughout the 1990s and peaked in the mid-2000s, with nearly 2 million annual deaths. Since then, the annual number of deaths from AIDS has declined and since halved. 2016 was the first year since the peak in which fewer than 1 million people died from AIDS. There is also a continuing increase in the number of people living with HIV. The growth rate has slowed compared to the 1990s, but the absolute number is at the highest ever. And this graph here helps visualize this. It shows how new HIV infections and deaths from HIV/AIDS have peaked and since declined. And it shows how the number of people living with HIV, the rate has decreased, but the absolute number is higher now than it has ever been. In terms of seasonal variation, HIV infected individuals have a higher risk of opportunistic infections during winter months, according to a National Institutes of Health article. This study found a higher prevalence of HIV among hospital admissions in fall and winter months, with patients having a 3 times higher adjusted odds of infection. I was unable to find any data about week, day, hour, or diurnal variations related to the HIV epidemic. However, this does make sense given that its mode of transmission is through bodily fluids like blood, semen, and vaginal fluids. It's unlikely that the transfer of bodily fluids significantly varies on a weekly, daily, or hourly basis. And that concludes my presentation. I hope you learned something new about HIV and its disease patterns, and thank you for your time. And then attached on these next 2 slides are my citations for the sources I used to make this presentation. Thank you.